Dr. Murray here. I've just come along to have a chat to you regarding your procedure and how to get prepared for it. I'm going to do this in 3 lots. It'll be the pre-operative preparation, the operative day and the post-operative care. Don't worry, we'll go through a lot here, but my staff are here to help you with it, whether in person or on the phone or on the net. They'll always be available to go through any questions that you have, so don't worry about it all. Hopefully by now you've had your first consultation and you've been through your consent form and you've read the risks that are involved. Most of the procedures we do here are low risk but not no risk procedures, so you have to be aware that there is some sort of a risk involved with any procedure. The information pack that you've received is full of information, and I'll go through this carefully. Don't hesitate to ask the girls at the front desk regarding our deposit and cancellation policies, and please be aware of the date of your procedure and where it is going to be done. It's very important to have the correct time and to not be late, as you'll be holding up patients behind you, and that makes them more nervous, as you can appreciate. Probably the most important thing is to organise your garment. Most of the procedures we do here, you will need a pressure garment. You can go to Device Technologies and order this over the phone, or you can go to Breast Care and do personalised fitting. These, the addresses and the phone numbers will be in your information pack. The next thing that we ask you to do is make sure that you have ordered your TED stockings, the stockings that go to your calves, as these are anti-clotting and increase the safety of the procedure. Blood tests are important. The most important thing is we're checking your blood clotting to make sure that you clot well. If you have any problems with blood clotting, don't hesitate to let me know. The addresses for these or the collection sites of these are on the back, and these blood tests are free, so they're a good thing to have just to check on your general health. Medications, you will have scripts in your pack. The antibiotics you start the night before. Usually it will be Keflexin 4 times a day. Please let us know if you're allergic to anything. If you're concerned at all, don't take the antibiotics without checking. Pain, most people will be prescribed Digesic, which is 2 4-hourly as needed. If you're only a little bit sore, don't forget you can still take one Digesic. The breast implant patients will have different medications, and I'll go through this later. For nausea, Stemetal 4 to 6 hourly can be taken as needed. We may also supply with Zofran wafers if you get extremely nauseated after sedation. And these are popped under the tongue or in the cheek and can be taken every 12 hours as needed. Arnica can be purchased from the pharmacy, and this prevents bruising, and follow the instructions on the pack the day before. You must cease aspirin, anti-inflammatories such as Nurofen, green tea and alternative medications 10 to 14 days prior to your procedure to avoid any interactions and also bleeding and bruising, etc. Continue with your usual medications, but inform us of what they are, and don't hesitate to query if you think some of them aren't appropriate. Smoking, it's really important not to smoke. You must quit 2 weeks before and for 2 weeks after your procedure. The skin can die from smoking, and we do have a smoking cancellation policy that is very strict, and I do enforce this. Fitness, it is good to build up your fitness before your procedure, and walking just half an hour every second day will assist in building your fitness up. Supervision, probably one of the things that concerns me the most is having a good supervisor. Mums are great. It must be an adult, full-time, and this is for 24 hours. Really, it's just the first night, someone that's going to keep an eye on you and give you your medications. They are in charge of your medications, as you can get forgetful the first night, and they must drive you to your procedure and back for the first 24 hours. You are not allowed to make any major decisions in the first 24 hours after your procedure. Try to have accommodation that is ground floor and within 45 minutes of our practice here in Nedlands. Follow-up appointments, these will be given to you, but on average it is day 1 and day 5 for most procedures, and then 1 month. The breast implant patients is slightly different to this. It's day 1, day 2, day 7 and day 12. I repeat, day 1, day 2, day 7 and day 12 for removal sutures. The most important thing is rest. A lot of people are very active nowadays and they don't rest enough after procedure. So you must rest at least 4 days, up to 2 weeks for some procedures, including breast implants. As I mentioned before, make sure that you know the correct surgery address and that you are on time. This is very, very important. Fees, the girls will go through the fees with you, but it's usually $2,000 to secure your theatre fee, and the balance is due 1 week prior to the surgery. Thank you very much. It's Glenn Murray here, and that's the end of the preoperative care and preparation, and the next feature will be, or the next video will be on the operative day. Thank you.